So, all right, here it goes. Hands down, Shantay. This here, I've done quite a few interviews. I've done quite a few interviews. I've talked to people on their platform about my book. I actually have spoken in, if that's, I mean, the correct way to say it, spoken, right? I've spoken
Hmm.
in front of uh, small crowds, larger crowds. You know, my clientele, which is the mental health demographic, and hands down, lie to you not, hands down. My mission, with my mission in mind, hands down, this is probably, no, not probably, this is the most excited I've been throughout my whole mission. Is to
Wow.
speak to you, a doctor from my city. You know what I'm saying?
Oh,
And not only am I inspired, or I have always been, well, we've been friends for years, but I've always been inspired by you. I
thank
have
you.
the opportunity to have you on a platform and increase the inspiration of the people that I am trying to gear this shit towards. So thank you 1,000 damn times.
Oh, you're very welcome. Thank you for having me. Thank you for having me.
Thank you. All right.
Yes.
For those who do not know, this is Dr. Shantay Dinks-Brown, family doctor, right?
Yes, family doctor.
Family doctor, family doctor. And the reason why well, one of the reasons why I brought you on here, because you're a great friend of mine. Another reason why is I was speaking to a good friend of mine yesterday. I was so pissed off about this whole situation, about the COVID-19, about the pandemic, about how we're approaching it, and about the do's, don'ts, and the things we know and the things we don't know. So I said, yo, what can we do about it? And then, he sat me down, he gave me this long speech, because, this is the big homie. He got to give me this long speech about what I should do in detail and so on and so forth. And I came up with this idea. I said, yo, the first person I have to speak to is a doctor, and I can't just speak to any doctor. Even though I have access to a few of them, it got to be Shantay, because Shantay has a voice that we're gonna listen to. We can take advice from Shantay, because Shantay is less likely to lie to us.
Right,
You
right.
know what I'm saying? So,
Gotcha.
all right, just real quick, can you give us a brief background? Just real quick, brief background. Your background.
Sure. So, I was born and raised in Camden, New Jersey. You know, uh, I was in high school around the time that Time magazine article came out about Camden being the poorest city in the whole country, and talked about all the bad things that were coming out of Camden. However, I came out of Camden High School in 1997 with probably one of the baddest classes ever, 97.
Yeah,
And so many of us were, doing positive things. And, in my mind, I was going to show them that there was something good that could come from Camden.
yeah.
So, I went to med school in South Jersey, at Rowan, which
Mm-hmm.
is used to be UMD&J. Went to
Yeah.
med school, did my residency, and came out family medicine. And I did family medicine specifically because I wanted to work in an underserved area. And
Mm-hmm.
so what I ended up doing when I graduated from residency is I ended up working in an underserved area. I started in Burlington City, and then I moved to Paulsboro and Camden,
Cool.
working there. And I'm currently not working clinically right now because I
Okay.
have smaller children,
Okay.
but the heart is still there.
Yeah.
And, it is my hope to one day either open up my own practice
Yeah.
or create a group where, we can focus on underserved area such as Camden and,
Yeah. Yeah.
bring the health to the people and
That's
to
right.
show our people that, they can be healthy, they can be prosperous, they can be wealthy, they can be, you know, uh, successful,
Yeah.
and that's, something that I want to show. So,
Yeah. Yeah, that's cool. Thank you so much. Thank you so much for real. And like I said, you've been an inspiration of mine. And I'm excited to even to introduce you to this these people on this platform, so that you can be inspiring to them.
Sure.
Quickly, like I wanted to go over the COVID-19 situation, right?
Hmm.
Um, this I don't know about everybody else, but this shit got me stressed out. You know what I mean?
Yep.
If I hear somebody cough, it's like, yo, and like, yo, Herb, what are you putting your fist up for? Like, you gonna fight COVID? Like, what? You know what I'm saying?
Listen,
So,
all of
like,
us.
yeah. So, what's the deal? What is this COVID-19? Like, what
So
is this?
COVID-19, whoo, it has, I'm pretty sure we have heard every name for COVID-19. COVID-19, coronavirus, the Rona, that's
Yeah,
what our people call it, the
yeah,
Rona.
yeah.
So it's a virus that originated in China. And, when it first came out, probably around January of this year, December, January of this year, a lot of people likened it to the flu. Oh, it's just a bad flu. It's like of having a really bad cold. Unfortunately, the difference between COVID and the flu is that there is no treatment for COVID. There is no vaccine for COVID. Uh, there is no cure for COVID. And so, this is a very serious illness that, unfortunately, us in the health field, we still don't know fully how it affects the body. Uh, there's so many studies out there that are being done, but it's been seen that COVID can affect the body in terms of the circulatory system, which is the bloodstream. So
Okay.
there's patients that have had concurrent heart attacks as a result of COVID. They've had strokes as a result of COVID. There are patients where it affects our digestive system. It affects you know every part of our body. And I don't think that we've ever seen a virus like this before in the medical community.
Really,
Yeah.
really. Wow. Okay. All right.
And
So,
in my opinion, I mean, it's a very serious virus. And I mean, every other virus that we've, seen and encountered, we've been able to overcome. And, I mean, there's been, viruses way back, where
hmm,
some people also compare this to the Spanish flu
okay.
of 1918. And I
Uh,
mean, that was when we didn't have the resources that we needed, in the
yeah.
healthcare field.
Mm,
But now we are so much more advanced, and so many, you know, specialists, so many doctors are stumped with this virus
yeah.
because they don't know what's going on, and we're learning from other countries, we're learning from other regions of our country on how to manage it. But, I don't think that we have a really strong sense of, what we can do
Okay.
other than prevention right now.
Okay. All right. So other than prevention, now I have one more question on that particular, like, underneath it. Um, I've been reading and I've been hearing a lot about our community, the underserved community, being more prone. And I've heard five, I've heard some 10 times and shit like that. So please break it down. Why us? Like, what's
Right.
why us? Like, wait a minute, hold up,
Yeah.
us?
Yeah. So you got to remember, when you're talking about our community and our community being an underserved community, you're talking about lack of resources. You're talking a lot of times about families that are living in small confined spaces where if one member of the household gets sick, it's not like they can go quarantine in the floor upstairs and nobody else goes upstairs, or they can quarantine and use the bathroom down the hall, because
Mhm.
most houses in our community may only have one bathroom, one and a half bathroom. And so people can't quarantine the way they need to. The other thing too is, really lack of education. Some people don't understand the signs and symptoms that they need to look out for. And so, they may be out and about more than they should and spreading it to others. And then a lot of times in our community as well, the lack of health care. They don't have the health
Yeah.
care that they need. And so it, almost gives us a fear to go to the doctor and find out what's going on, or to go to the hospital and get the treatment that we need, because we don't want any extra bills, because we don't have the money to afford, taking care of ourselves the way we should, in the way that we deserve to be
Yeah.
taken care of,
Most definitely.
because we don't have the resources that we need.
Most definitely. All right. Cool. I like, as you were saying that, I'm like, damn, I'm putting myself right there, and I mean, it almost was like it was a picture in front of me, and I understand totally what you're talking about when it comes to
Oh
that.
yeah.
All right. How do we? What do we do? You said other than the prevention measures, right?
Hmm.
That's what you
Yeah.
said. It's nothing else we could do but the prevention thing. Now, I'll tell you one thing. I've been, since this shit came out, I lied to you not. I've been taking multivitamins. I've been
Hmm.
taking all type of shit, like really, like, drinking water a lot more. I've been doing a lot of stuff like that. What preventative measures do you think that we should entertain, or we can entertain within our means? I mean, a lot of people, like you said, being able to afford certain things. Nobody want to go and buy no damn multivitamins. They need,
Right.
they,
They're expensive.
prior.
Listen,
Yeah, yeah.
you got
So
to eat.
yeah. So what do we do?
So, you hit the nail on the head. Vitamins A, yes, definitely. But, some of the more important vitamins that we know help to strengthen your immune system would be, vitamin C, vitamin D, which, oh my goodness, most African Americans have a lack of vitamin D, which comes from the sunlight,
Mm-hmm.
which comes from the food that we eat. And the reason that we have this lack of vitamin D, a lot of times it's very simple. We're brown skin. We have melanin in our skin.
Mm-hmm.
The sun doesn't absorb as well. And so we have this lack of vitamin D. Increase your vitamin D. Either sit outside in the sun for a few minutes every day, protect your skin. Take vitamin C. You can eat oranges for vitamin C. There's
Okay.
tons of food that are vitamin C rich. Zinc is another good vitamin.
Where you
But
get that
like
from?
you said, so multivitamin that I know of, I'm not really 100% sure of foods that are strong in zinc, but I guarantee you, everybody has a smartphone these days. You can
All right.
definitely Google, foods that are high in zinc, foods that are
Okay.
high in vitamin C,
Okay.
even foods that have vitamin D in it. I mean,
Yeah.
get our resources, But the other things that we can do that cost little to no money,
Yeah.
to keep our immune system strong: drink water, like you said, plenty of water, get
Mm-hmm.
plenty of sleep,
Okay.
because if you're not sleeping, you're not allowing your immune system to get strong.
Okay.
So, lack of sleep has been associated with decreasing your immune system.
Okay.
So people have been known to get sick easier because they don't get enough sleep.
Yeah.
That's something simple.
Mm-hmm.
Washing your hands.
Washing the
Your
hands. All right.
hands.
Yeah.
So the CDC recommends, and the CDC is the Center for Disease Control.
Mm-hmm.
They are, the ones that help us with all these infectious diseases. And
Mm-hmm.
so that's where a lot of our education and a lot of our information comes from, as healthcare providers. So the CDC recommends washing your hands for at least 20 seconds.
20 seconds.
Soap and water.
Soap and water.
Hot to warm water. Not too hot where you're burning your skin,
Mm-hmm.
but warm enough where you're killing these germs. Give them a nice scrub in between your fingers, underneath your nails. 20 seconds. They say you can sing ABCs twice or happy birthday twice, and that's enough time to wash your hands. Those are some cheap alternative ways to prevent the spread of this virus. The other thing that we can do that is also not very expensive is wear a mask when you're outdoors or when you're in groups of people, specifically people that you don't live with. Okay. Wear a mask if you are in large groups and around people that you don't live with.
So that includes like family members and stuff like that, like outside of your home,
Yeah.
right? Okay.
I would say
Okay.
that if you are around family members that you have not been around, you have not seen, you should be wearing a mask. You don't know where people have been. You don't know what people have done. Some people are still working and they're around other people. Some, people are still grocery shopping. People are still going out and doing what they need to do. So the best thing you can do is to protect yourself by wearing a mask
Cool.
and staying 6 feet away from, other people that you
Okay.
don't live with.
Okay. 6 feet and wearing a mask. All right.
Hmm.
All right, the actual mask. We walked in Walmart the other day, and I we I was looking for a mask. This mask was too tight. I had on from the car, or whatever, and I'm looking around for the mask. I looked on they have a bin sitting there, and I'm like, yo, they wanted too much money for this mask. And it was
Hmm.
just a temporary situation. And that was for me. I have a pretty decent job. So I'm like, all right, well, what do we do? All right. The question is, what do we do? If we don't have the funds to get a mask, what else do we do? Do you suggest anything else?
Yeah, so you can use any cotton material in your home.
Okay.
Some people wear the scarves or the bandanas.
Mhm.
You can use that. So the key is the reason that the masks are important is because it protects from the respiratory droplets or spit, snot,
Yeah.
uh, that type of thing. So when we
Mm.
talk, when we laugh, if we yell, if you cough, if you sneeze, you're letting out, spit, saliva. And in that, if you have the virus, that can spread the virus to others.
Shantay, that's very. I like how you put that one because that's very important. A lot of people don't know that this shit travels. Like, you know what I mean? Like,
Mm-hmm.
what we talking right now, like it's probably traveling to my screen. You know what I mean?
Mm-hmm.
From me talking and stuff like that. So if I'm, like they say, asymptomatic, meaning that yeah, I have coronavirus, but I'm not showing any symptoms, and there are a lot of people around like that, right?
Yes.
And
Mm-hmm.
I'm talking to you, and you my cousin, and we hugging and shit and all this other stuff,
Right.
and you have, and that's one more other thing I wanted to speak to you about pre-existing conditions, because I'm hearing this thing pre-existing, and this is existing conditions prior to me catching coronavirus could lead me to really like being terminally ill, like dying
Mm-hmm.
from this thing. But if I'm hugging my cousin and I'm asymptomatic, and meaning that I'm not showing no signs and symptoms of this coronavirus, but I do have
Right.
it, whatever, and I pass it on to my cousin, they can ultimately pass away from me showing them some love. So my
Right.
love killed them.
Right.
You know what I mean? So
Right.
talk to me talk to us about
No.
these droplets, these respiratory droplets, how far they could travel, uh, why they recommended 6 feet, how long they can stay in the air, stuff like that, if you can.
Yes, definitely. So the respiratory droplets, the reason that they initially started saying to stay 6 feet away from people is because they were finding that the respiratory droplets, when you talk, when you laugh, when you cough, or when you sneeze, can travel as far as 6 feet. Now, there are some studies that have been done that have shown that droplets can sometimes travel as far as 15 feet. So,
Woo!
so all the more reason not to only, what they say, socially distance yourself or stay 6 feet away from people, but to also wear a mask, because now they're saying respiratory droplets can go even further. So you want to protect yourself. And like you said, if you have any pre-existing conditions, there are conditions that can affect your body that lower your immune system. So if you have pre-existing conditions, cancer, you've been on chemotherapy, you have a lower, uh, your immune system is not
Mhm.
as strong. If you've
Yeah.
had any type of transplant, kidney, liver, even heart, anything like that, you might be on anti-rejection medicines, which can lower your immune response. People that have breathing problems, COPD, asthma, even diabetes can, sometimes cause a decrease in your immune response. And so, these are all things we want to look out for our elderly patients, our pregnant patients, our pregnant friends, our elderly family members, your aunties, your uncles, your grandmoms, your grandpops. You want to protect them. Infants and babies, they don't have the strong immune system that we have as adults. And so you want to protect them as well. So those are just, a few pre-existing conditions that are very, very susceptible or very likely if they come into contact with someone that has COVID or, is symptomatic or asymptomatic, but they have COVID. Those are some of the populations that can be affected.
Okay. Damn. And as you saying that, in my mind, like I said, your words is like creating these pictures in my mind, man. And when you saying that, because it's the first thing people say, like we identify with the sugar, like such got that sugar. You know
That's
what I mean?
right. Yeah.
I just talked to my little cousin yesterday, and he was like, they told me that I'm pre-diabetic, so I gotta do this and do that. And I'm like, dude, man, you gotta just cool out. And a lot of it, I do know, come from the food that is readily available to us in the city, and come from the lack of exercise. And I tell you, from my surroundings, and that depressive, feeling sometimes have us just chilling. You know what I mean? And just sitting on our ass all day.
All day, yeah.
And yeah.
And
go ahead.
Something else you said too. You said, when you hug your cousin, even if you're asymptomatic, you don't know if you're giving it to your cousin and they could be giving it to somebody else. So a lot of times, wearing the mask is not necessarily just for us to protect us, but it's to protect those that we love, because it stops our respiratory droplets. If we're asymptomatic, it stops us from spreading the virus to other people that we're around.
Yeah. I want to tell you something funny. I was actually on the phone with a client of mine, and he was walking down the street and he saw his cousin. He said this was during the pandemic. And he said, "Yeah, cousin, what's up?" And they hugging and stuff, whatever. And he said, "Yo, give me a short of that cigarette." So I'm looking at the phone. I'm looking at the phone and we talking, and I said, "Yo, we just finished talking about, I don't, preach to them about that. I just talk to them about evidence-based, stuff that I have. You know what I mean? That's it. Like, yo, you're not supposed to do X, Y, and Z because you can increase your chances of, catching the COVID or whatever. We just finished talking about this. And it's like, oh, well, that's my cousin. I'm like, all right, well, cool. I'm going to ask you a question. You think your cousin can catch that shit? This is exactly what I asked him. Do you think your cousin can catch it? Oh,
you got to get real.
I ain't never think of that. I'm all right. Do yourself a favor and start thinking, man, because you wildin'. You know what I mean?
That's right. Yep.
So I greatly appreciate you for this, and I know that for one, I appreciate it, and I'm like the most excited I've been in probably the last 18 years of my mission here. With service in my community, and it's just a special thing that I could do this with you.
Oh, thank you. I appreciate it. No, thank you for having me. I mean, this has been, something on my heart. I even put on my Facebook page a couple of weeks ago, that, I understand people's need to get out and to, enjoy the beach and their family, have the barbecues for graduation and, different things like that. But it was really disheartening to me that our people were like, we were not wearing masks. We were just out and about. And I mean, yeah, that's your cousin and that's your auntie, but you have to protect yourself. You have to protect them. And I mean, it may not be cool or comfortable to wear a mask, but I'll tell you, there's a bunch of memes, that it's more comfortable to wear a mask than to have a ventilator, than to be on a ventilator. Listen, I'd rather have a cloth mask any day than a hospital mask with oxygen or be on a ventilator. And, our people need to realize that, they're opening things up, and you got to use wisdom in these things being open. Like, yeah, you want to live your life, and you want to, like, you're tired of being cramped and cooped up in the house, but you got to be careful.
Yeah.
Go enjoy your life, but be careful about it. Wear a mask if you can't afford to buy a mask. And it doesn't have to be a hospital grade mask. As long as it's keeping those respiratory droplets in, that's what's important. So put that bandana over, take an old t-shirt, cut it, you know, put it around you, anything just to protect yourself and protect those around you. That's important. And wash your hands.
Quickly. Now, how am I putting this on over everything right here, or what? Like, what's the deal? Like,
That's a
how am I
good
doing?
question. Yes. Yeah. So your mask should be worn over your nose and over your mouth.
And over the mouth.
Yeah. So it should go.
So it
from
can't
about
go right
here.
here.
No.
All right.
Can't go there. It should go from about here to about here.
All right,
okay.
Cool.
And it should fit snug enough where, you know, you're not restricting you from breathing, but that you're protecting yourself and that it's staying on you. I've seen a lot of people with the mask below their nose, just covering their mouth. I've seen people with the mask on their chin, the mask around your neck. That's not the way to wear the mask if you're trying to protect you and protect those that you love. Yeah. You got to cover your nose and your mouth.
Thank you.
You're welcome.
Thank you. Information and inspiration is what we will get out of this. And that's real. That's real. Oh man, I'm so emotional right now. I'm on the line with a doctor and from my town, from my city. You know, and I mean, it's still, it don't matter. Every single year, you know, I celebrate you every time I get a chance, and it doesn't matter that we have contact with you all the time and so on and so forth. That doesn't matter. What matters is I have the opportunity to present you to as many people that is going to pick this thing up and listen to it or watch it or whatever, because it's going to actually be on the audio is going to be on the podcast and the visual will be on, you know, YouTube or something like that. And I'll put it on Facebook and all that. But man, it's an emotional moment. Thank you so much. This is going to get a lot of information out to a lot of people, and I really couldn't have this conversation with too many people because we wouldn't be able to break things down the way we need to break things down to the audience that you know, patronizes this podcast.
I mean, sometimes you got to break it down into, you know, concepts and, you know, ideas that, you know, we can all understand. Like, not everybody, you know, is able to. I mean, listen, I'm a doctor and I'll still read books sometimes where you and I were talking earlier. I'll read a book and I'm like, what does that mean? You know? So listen, I'm just because I went to medical school doesn't mean that, you know, I'm game and I'm hip to everything out there, because I'm not, you know. So sometimes I need it broken down the way I can understand it. And I feel like that's what we need as a people. We need it broken down the way that we can understand it. And that's the importance of this platform. And I'm glad that you had me on, and I appreciate it.
Oh, I appreciate you. And I'm telling you that everybody who touches this thing is definitely going to appreciate it. Okay.
Definitely.
So any closing comments? Any closing comments you have?
No, let's just, you know, get this information out there. Encourage everybody to just protect yourselves, be careful, wash your hands, stay healthy, wear your mask properly, and you know, just stay healthy.
Cool. And I hope this is not our last time together on this platform. I do have some other things to speak to you about in the future, in the near future. But I got to get this message out to our people about this COVID-19. We wilding right now. We out here partying and shit. So I got to get this message out to them.
Yes, definitely.
Thank you so much. I love you, Shantay.
Love you too, brother. No problem.
All right. Thank you.
Talk to you soon.
Bye-bye.
All right. Bye.